Thank you so much for having me, Anna and TV Vets. Please, Anna, especially interrupt me as I go. I get really excited and passionate about this work and could just go on forever. But if there is a need to stop me, I really invite you to do so. I'm not going to be able to see everybody on screen. So Anna, I invite you to interrupt me as we go. We're going to have about a half an hour at the end for questions and some dialogue. We can try and manage that as best we can with a big audience via Zoom. And yeah, I'm just going to jump right in. So I wanted to start, before introductions and framing and all of that, I want to just start by inviting you to think about what health means to you. And, it's a big concept.
Hello.
Hi. Who's interrupting?
Hello. I can't hear anybody.
Oh, Anna, are you able to help?
Yes, I'm going to help.
Okay. And I do actually see just a few people who are not muted, and I do invite you to mute because we can get some awkward feedback at times. So if you can find that little microphone button, just click on it until it turns red and has an X on it, and that would be really, really helpful.
Yeah, I can also mute everybody if you want, and then you can unmute yourself if that helps.
Yeah, let's do that, Anna.
Okay.
Unmute. Good. Okay, off we go. So now you've been given a little bit of extra time to think about what health means to you and how it maybe shows up in your life now compared to maybe when you were a little bit younger. How has this concept of health changed for you? And if you're savvy with the text boxes or the chat boxes, feel free to stick in a comment or two about what health means to you right now, and I'll try and pepper those into to the presentation as I'm able to. A lot of people come up with this idea that physical activity has an influence on their health, and maybe our physical activity behaviors and commitments change as we age. Certainly social activity can really influence how we're feeling, if we're feeling healthy. And if anybody's been around the last 2 years, our physical and social activities have really changed over the course of the pandemic, and you may be experiencing some impacts on your health as a result. And so I want you to keep close your concept of health throughout the presentation. And by the end of this presentation, you will have some deep and broad understandings of the benefits of physical activity for your health. And you'll also learn about the unique approach of Choose to Move in promoting physical activity, social activity with that goal of improving health. And you'll learn about how to get involved with Choose to Move. It's available in BC, across the province, through a variety of providers, and I want to tell you all about that. So, as Anna mentioned at the top, I'm Sarah Lusina. I am currently serving as Executive Director at the Active Aging Society, the provider of Choose to Move. And I also serve as the Director of Strategy and Partnerships at UBC's Active Aging Research Team in the Faculty of Medicine. And this is the team that is designed Choose to Move for you, for older adults across BC and broader. I have an educational background in the exercise sciences and physiology, and have worked for a long time with different organizations and researchers to bring out that some of the best evidence to promote the health of populations. I want to extend a big thanks to Anna and TV Vets again for inviting me here and to share some of our work to your donors and to your audiences, because there is, I think, some real benefit to you and what we do. And thanks for spending your afternoon hour with me learning about Choose to Move. Before I go too much further, I just want to acknowledge that I'm on the unceded and ancestral lands of the Coast Salish people. I'm joining from the Deep Cove area. And if you're not sure about the ancestral lands of where you are, I invite you to go to native/land.ca. And it's a really informative map to learn about the Indigenous communities in the places that you live. And if you haven't looked at the 94 calls to action put forward by the Truth and Reconciliation Commission, I invite you to do that. And I do so as a step towards reconciliation on behalf of myself and my organization. So who are we? I think it's important to orient you to our organizations. So again, I'm representing the Active Aging Society, and the Active Aging Society works with service providers across the province to provide Choose to Move. And we've worked in collaboration with UBC and the Active Aging research team at UBC, who designed Choose to Move based on the best research and continues to evaluate Choose to Move to ensure that it's effective at supporting the physical activity, social activity, and health of seniors across the province. And we're so thankful for the commitments of the BC Ministry of Health to support our program and to commit to the health of seniors long-term and upstream, beyond healthcare and health services, but also that community opportunity to stay active and involved in their community through Choose to Move. And the information that I share here today is the work and vision of so many people at UBC and the Active Aging Society. So you'll see up there on screen the leadership of our team, Drs. Heather McKay and Joni Sims-Gould, the true architects of this work, and all of the trainees and staff who work behind the scenes to make Choose to Move available. So before I get into Choose to Move and how you can get involved and what it's all about, let's talk a little bit about health and physical activity. So this is a trivia question. Don't shout your answers out over Zoom here, but just think to yourself, what kills more people each year in the US? This is a US based study. What do you think? Is it smoking? Is it obesity, diabetes, or low fitness? What do you think could be the driver of the most deaths? Now, Anna and I tried our technology beforehand, and unfortunately we couldn't get the videos to link. I know she's going to share this video link with you later, but it's a great little sketch by Dr. Mike Evans, who is a staff physician at St. Michael's Hospital and an associate professor at family medicine at U of T, and he's put together a video just asking you if you could maybe limit your sitting and sleeping to just less than 23.5 hours a day. And that means, for 30 minutes of your day, can you get up and can you be active? And so that video will be sent to you in follow-up. But it really does drive home what that biggest risk is to our health. That's a bit of a teaser. It's low fitness. Having low cardiorespiratory fitness, so heart and lung fitness, kills more people than smoking, diabetes, and obesity combined for both men and women. So on this graph, you can see the attributable fractions for all-cause death in both men and women are higher for those who have low fitness compared to those who maybe who are smokers, who have been diagnosed with diabetes, and who are clinically obese. And this is adjusted for all other factors that could impact outcomes. And as you know, to achieve fitness and cardiorespiratory fitness, we need to think about doing aerobic exercise, and that could come in the form of a brisk walk for up to 30 minutes a day. And this research has really helped support some new physical activity guidelines and even our previous physical activity guidelines for different populations. For older adults, we know that we need to be active throughout our day. So not just, that one 30-minute period throughout our day, or in our day, but being active throughout our day, building in a bit of physical activity throughout our day. And so the new physical activity guidelines from the Canadian Society for Exercise Physiology asks us to think not only about our physical activity, but also about other components of our day, like sleep and sedentary time. And Anna will include a link to the Canadian Society for Exercise Physiology's guidelines for older adults for your interest and review later. But our whole day really does count. And so, for health, our 24-hour movement guidelines ask older adults age 65 and older to be physically active every day, really minimize our sedentary time and get sufficient sleep. And it's, they set goals within the guidelines, but they also ask you to work towards those goals. So, if the goal is 30 minutes a day of physical activity or 150 minutes of physical activity a week, maybe that's starting off with 10 minutes a day of walking. And there's a real focus on working towards those goals. And this feeds into the design of Choose to Move, our physical activity promotion program. And just like that previous slide I showed, there are big health benefits, lower mortality, lower cardiovascular disease, hypertension and type 2 diabetes, a variety of cancers, and then also anxiety, depression, dementia, and big benefits to bone health, cognition, quality of life, among others. So if you go and have a peek at the physical activity guidelines, you'll see, and this might be a bit hard on your screen right now, but you'll see that, within those three components of physical activity, sleep, and sedentary time, they're asking us to engage in moderate to vigorous physical activity, such as walking, where you've got your heart rate up, you're taking some deep breaths, you might even begin to sweat. And again, that 150 minutes doesn't have to be done all in one day, it can be spread throughout a week. And also engaging in some muscle strengthening activities, activities that challenge your balance. In terms of sleep, striving for 7 to 8 hours of really good quality sleep, and having a regular sleep routine where bedtime and wake up time is around the same time, and that your routine heading into bed enables you to really maximize your sleep throughout the night. And sedentary time, we're all probably, in the context of the pandemic, sitting way more than we would like to in front of Zoom instead of in a community center gathering for a presentation like this. But if we can, reduce our sedentary time to less than 8 hours and break up that sedentary time so that we're not sitting for any more than 3 hours at a stretch. And there's good evidence behind that too, in terms of our physical health and physiological responses. At a population level, I'm sure many of you know that our demographics are changing. By 2051, 1 in 4 Canadians will be over the age of 65. So really figuring out how to support older adults is really compelling, because they make up a big portion of our population and have contributed greatly to our communities and all the benefits and structures that we have in community now. And certainly, the changing demographics, it can present some challenges if we can't maintain a certain level of mobility and independence. Our strains on other systems can increase, and that's something to consider as well. But ultimately, we want everybody to live a high quality of life independently in community, and enjoy their time. We know from research that 85% of older adults are not meeting physical activity guidelines and are spending a lot of time sedentary each day. So the risks are high in terms of health outcomes. And, you know, aside from the mortality risk, we also know that physical inactivity costs a lot of money. A 2012 study showed $6.8 billion in associated costs related to physical inactivity. So again, a compelling reason, not just for us personally, but as a community and society, to really tackle the physical inactivity challenge. And as I said before, indeed, physical activity is sort of that pill that cures all. It has so many positive health benefits, and not the least of which is an improved quality of life. So as we get older, we know that our social networks change, and some of our social opportunities decrease. And current research shows that 1 in 4 older women and 1 in 5 older men report feeling lonely at least some of the time. And you know, this is a result of those changing social networks. You know, maybe family moving, children moving out of town, retirement, and that interaction with colleagues might change. Perhaps people choose to downsize and they're not close to their neighbors anymore. So those friendly connections in community may change and really create some feelings of social isolation. And we know that there are health risks also associated with being lonely or socially isolated. Older adults who identify as being lonely have a greater risk of all-cause mortality and morbidity. And the health consequences, like to really, you know, break it down, the health consequences of being lonely can be as detrimental as smoking 15 cigarettes a day. So leaving loneliness unaddressed is a real health risk. And we need some solutions to kind of get people social and active in their community again. And, you know, nothing can be done today without talking about COVID-19 and the COVID-19 pandemic. But we do have great research to show that when we're physically active, we have immune benefits. Our immune systems are stronger and can fight off infection and resist viruses better. You know, early data and research being directed specifically to the coronavirus and physical activity. So too early to say about that virus in particular, but previous research showing that immune benefit of being active and physical, and also the immune system benefits of being social and socially active, and that avoidance of those feelings of loneliness having benefits to our immunity. So again, you know, some solutions to support our physical and social activity is really, really critical. So I want you to think about, maybe it's back in 2018, 2019, but I want you to think about the last physical activity program or experience that you had, or what did that look like? You know, what motivated you to get involved and stay involved in that physical activity program or experience? Why did you show up in the first place? How did you maintain that behavior? If it was a dance class, did you register every season? Or if it was a walking club, did you maintain your walks even when you moved out of town? And you know, how are you managing your physical activity now? So think about those, and I look forward to the Q&A session to hear some of what you came up with. So again, because our technology and video links failed, I'm unable to show a great little clip by Dr. Hister, but I know Anna will share it with you after the presentation. So let me tell you about Choose to Move. This is our solution to physical inactivity, social isolation. It's really an opportunity to get older adults involved in their community and active for the long term. It's a signature initiative of the Active Aging Society. It's the primary program that we offer, and it's been hugely popular since 2016. So Choose to Move is, oh, I think somebody just popped off mute, so I'll just invite everybody to just check your mute line there and make sure you're off and quiet. So Choose to Move is based on the concepts of behavioral change and goal setting. It's supported by a trained activity coach, an activity coach who trains with the Active Aging Society through some dedicated training sessions. Choose to Move offers both one-on-one support from your activity coach. So if you were a Choose to Move participant, you'd have a chance to connect one-on-one with your activity coach and be connected with them to set some goals and priorities for yourself. And you'd also have the opportunity to meet with peers in the program in group meeting settings to share your experiences and also to share some of the challenges within your own activity plans. And it's a wraparound program. So it's designed to really help you build in some new habits and connections and learn how to navigate some of those physical activity and social opportunities in your community. So I think I'll just bring you over to the next slide. It gives you a bit more of a visual of the Choose to Move journey. So if you were to enter Choose to Move, you'd start here with an information session. The activity coach usually gathers those who have expressed interest in Choose to Move to just break down what the program is explicitly. It's not a physical activity program. In Choose to Move, you don't actually typically do very much exercise. You talk about it a lot and think about it a lot, and you might do, hopefully you do some physical activity outside of the Choose to Move group meetings, but Choose to Move really is that goal setting, action planning program to help you build physical activity into your everyday. So like a coaching program. If you do join Choose to Move, you'll meet with your group at the first group meeting, and in these group meetings we review a whole variety of health topics that are of interest to you. I'll go over that in the next slide. Then you come together one-on-one with your activity coach and really zero in on your goals, the activities that interest you, and then you move along throughout your Choose to Move journey, attending these group meetings pretty much every other week, and working towards those personal goals that you've set for yourself. And when you get here to the end of the program, you are equipped with habits and skills to maintain physical activity beyond the 3 months of the Choose to Move program. So I had mentioned that I would share with you a list of some of the topics that we cover in Choose to Move. And you know, it varies from program to program, but generally speaking, the first group meeting starts off with a welcome and some background on what goal setting is and the value of goal setting. And from there, you go on to talk about physical activity a little bit more in depth than I did at the beginning of our presentation, and the benefits of social connections. And you go on to talk about nutrition, falls prevention, brain health, and so on. And you know, really from a participant experience, it's very different than your average physical activity program. It's not a 3-month program where you show up every Wednesday at 1 p.m. and do your aerobics activities. But if that's something you're interested in, you could set that as your goal And you could choose that as part of one of the activities that you wanted to do. Your activity coach may even point out some other activities that are available in your community that you didn't know about that you're interested in. You build that into your plan. And throughout the Choose to Move program, you gain support from peers and from your activity coach to problem solve some of those maybe barriers that are coming up as you're pursuing your action plan, your goals, and throughout the program, you're making new connections with those who are in Choose to Move with you, as well as maybe somebody who you met in that walking club, if that was an activity that you chose. And certainly you learn a lot in those group meetings about keeping healthy beyond just physical activity, and you gain access to a lot of resources in your community. So over the course of the pandemic, we did pivot and offer our programs online in a virtual environment to those who that worked for. When it was safe to do so, folks gathered in person and continue to do so in communities where it still feels safe and the organizations are able to do that. We always follow the guidelines from the from Dr. Bonnie Henry and the public health offices. And really, Choose to Move can look quite different depending on the organization that offers it. Might be marketed a little bit differently, or maybe some of the group meetings may be a little bit different from program to program. We really work with the organizations, and they know their community best, so we tailor to meet their needs. So I just wanted to share with you a couple of our successes to date. We've had huge reach, so it really tells us that Choose to Move is something that BC seniors are really interested in. We've had over 6,500 older adults participate in our program. We've had over 650 programs delivered in the province. And, we've got lots of activity coaches trained to deliver. Many of them have specialties in working with older adults, working in community settings. Some of them may even have a fitness background, and some of them bring that expertise into the work that they do. And Anna will share in the resource package at the end of the presentation a link to the Active Aging Research Team's website. If you're really interested, you can go on and read all our publications about the impact we've had to date. But we do see time and time again over the years of delivering Choose to Move that physical activity increases in our participants. There's a benefit to participant social connectedness. They feel less lonely, less isolated, more in touch with peers and those in their communities. And they know how to navigate some opportunities in their community, and that's really important. Sometimes it's all just below the surface, and we just have to kind of peel back a layer, and Choose to Move definitely aims to do that. So if you're looking to look out for us, here are some of our many delivery partners. This is not an exhaustive list, and I will share a link to find current providers of Choose to Move. But we've been with a variety of neighborhood houses here in the Lower Mainland of Vancouver. We've been with the YMCA. We're in the West End of downtown Vancouver, as well as in a variety of communities in the north. Our big providers of Choose to Move, the BC Parks and Recs Association and YMCA, bring us across the province. So I just wanted to share a couple of statements by some of our participants because I thought they might resonate with you. Again, working in collaboration with the Active Aging Research Team, we're really able to pull out a lot of the benefits of Choose to Move through their evaluation. And here, we see a quote that really does speak to a trend in our program of finding some friendship and finding a way to connect in an active way. So that this participant talked about some wonderful friends that she met and how they would go on regular walks a couple times a week. Other participants talk about, some of the health benefits that they've had. Falls and fall risk is increasingly on the radar of people as they age. And this participant talked about a fall risk or a fall that she had, and she was, so thankful for having joined Choose to Move because she felt so much stronger and able to recover and avoid falls, or recover from and avoid falls. And she took on activities like gardening and walking as well. So I'm going to take a few more minutes here. We're at 4:30, and just let you know how you can get involved, because I hope all of you are interested in joining Choose to Move and benefiting from some of our resources that are available online. So through this link, and again, don't feel panicked to have to try and jot that down right now, because Anna will send it to you. But if you go to our choosetomove.ca website and click on our locations button, it's highlighted there, very small text there in the bright blue. If you go to that tab, it'll pop up a map as well as a list if you prefer, and you can see all the programs that are operating now and upcoming. So if you were living in Prince George, you would be able to see whether or not we have a program coming up, or in Surrey, if there was something coming up for you in the spring. Regardless of whether there's a community in or a program in your community or not, you will also benefit by subscribing to our newsletter, our Choose to Move check-in. And again, there'll be a link provided to you on how to subscribe. But if you go to our Choose to Move website and click on subscribe, you can fill in your information and get those newsletters. And like Choose to Move, our newsletters are designed to help you focus on a goal for that 2-week period, and it equips you with some resources to set you out on that goal. Our newsletter team, our communications team, has put together some really thoughtful newsletters. For example, how do you keep active in wintertime in a pandemic? Well, if you don't know the answer, you can join our newsletter and you can be supported with a number of ways to keep active when it's cold and dark. This is basically what our newsletter looks like. The other really nice feature of our newsletter is that it offers a challenge, so to bring you over to the next week. You can join our Facebook page. Again, resources are shared there, as well as promotion of upcoming programs. And if you want some immediate resources on topics that interest you specifically, you can go right on over to the Choose to Move Get Active page. So again, there's a tab on the choosetomove.ca website called Get Active. If you go there, you can search through a whole variety of very high quality resources based on good evidence from reputable sources. You can find out about chair exercises or mental health supports, strength and balance exercises, lots of really great videos that you can do at home and on your own or with a friend over Zoom. And if you really want Choose to Move to show up in your community, you can encourage a local service provider, your local recreation center or your local neighborhood house or senior center to hop on the Active Aging Society's website and go to our Become a Partner page, fill that out. It comes to me, I'll know you're interested, and we can look at ways of making Choose to Move available in your community. You can always write your MLA and tell them that you want Choose to Move to come to your neighborhood as well. Again, we get our support currently from the BC Ministry of Health. They prioritize seniors' health and community, and we're grateful for that. So there's a few resources. Again, Anna's going to share them. I'm going to end here